Hello everyone, welcome to our final video of our Aging Well Falls course. We all really hope that you've enjoyed yourselves and learned a lot. I'm going to summarise some of the things that we visited over the past 4 weeks and mention a few of the more controversial topics. Early on in the course we discussed whether falls were a normal part of ageing, and I was pleased to see that many of you were accepting that falls are not inevitable, they occur at all ages, and that society really needs to change its views on falls. I hope that you will disseminate this to your friends and family, and with the overall aim of changing the way that society sees falls. Early on in the course we discussed falls risk factors, and two factors which were rather controversial was the magic number 4 of medications and wearing bi and varifocal lenses. I would ask people, forget the magic number 4 and just consider that being on more medications increases your risk of falling more. For bi and varifocal lenses, you're free to wear them, but just be aware that if they're new to you, then it might increase your risk of falling. You can find a blog which explains more details about medications and falls and varifocal lenses and falls. Later on in the course we showed a video of how to stand up after having a fall. Some people felt that the technique demonstrated wouldn't be appropriate to them. Usually that might be because of knee or hip problems. What we would suggest is contacting a physiotherapist or maybe an occupational therapist to ask them to devise a technique that might be useful to you. Some people have been asking how to access a falls clinic. This is very much dependent on where you are in the world. In the UK, everybody should have access to a falls clinic, but even if you don't, there are simple things that you can do to get a falls assessment, even if it's not in all one place. So visiting a doctor to have your medication reviewed, accessing a physiotherapist, and having an occupational therapist visit you at home. Those are the 3 core members of a team that can help you with falls. Exercise has been a hugely popular topic over this course. We've discussed how exercise can help prevent falls, but we've also found out that exercise is very important just for healthy ageing as well. Accessing exercise, it will vary upon where you are. So for some people it might be exercising in the home, and that might mean a physiotherapist coming into your house to give you exercises to do. For people who are able to go out, you might be able to find an exercise class that you can go to, whether it's specific to falls prevention or a more general class. There may be services that you can find in your local clinic or general practice, giving advice on where you can find exercises, but also there are other resources such as village halls, community halls, and evening classes. Another question, a very difficult question to answer, is how do we persuade our friends and relatives to recognise that they're falling and that they need help? It's not easy, but one thing we do know that works is using positive language rather than negative. So if you're trying to persuade someone to accept an occupational therapist visiting them in their home, we would recommend using language such as, an occupational therapist can help you stay independent, rather than saying an occupational therapist can prevent you from falling. It seems that people respond a bit better to positive language. So we've reached the end of our Aging Well Falls course. I hope you've learned a lot, and I hope that you'll be able to pass on many of the messages to your friends and relatives. Let's make a positive difference and let's age well. Thank you very much, and goodbye.